पेन बहुत ज़्यादा सीगी मैनू ऑपरेट तो पहला भी बहुत ज़्यादा पेन हो रही सी बट
Usually, the notion here in India is that if you get your spine operated upon, then you'll get paralysis. You won't be able to walk after the surgery. But this is not so. I will just show you how the technology is advanced, and you don't need to even give a stitch on the patient, and the patient is able to walk after 1 hour and out of the hospital by the evening. It's a real outpatient procedure now. So this patient, Mrs. Mandeep Kaur, she came to the hospital about a month back, and she has severe pain. She couldn't even get up. She couldn't even walk. And we conducted the MRI on her, standing MRI, to get the exact location of the disc in her spine. It was L5S1. I'll just show you how the MRI looked at that time. So here is the disc, L5S1, as you can see. Yeah, it's a big disc. This is the main spinal cord which is going down, and at each level a nerve goes on to the leg, on the side, maybe the left side or right side. I'll show you which side is left, this side right. And these are the normal discs. This one and this one, these are normal discs. They are contained in between the vertebrae. And as you can see, this blue thing, this is jetting out and it's compressing the yellow. This is spinal nerves which are going behind the vertebrae. So it's a big disc. See, if you can decipher it, if you can see it clearly, the nerve which is going down has been completely compressed by the extruded disc. Again, so that's a very, now if I enlarge it for you, yeah, here it is. So it's a real big disc which is going around and compressing the nerve. Here, a big L5, this is the L5 vertebra, this is the S1 vertebra, sacral first and lumbar fifth vertebra. Now let me go down to show you which side the disc is. Yeah, so this is the right side, that's the left side, and you can see a big disc more on the right side. This black one is nerve, the left nerve, that would be a L5 nerve on the left side, and you can't make out the nerve where the nerve is on the right side. So this disc has come out of the space. It has compressed the right nerve and more or less compressed the whole caudate vein. That's what we call the caudate vein. So it's a pretty big disc. Let me enlarge it for you. Here, you can decipher it very well. You can see it very clearly. It's a big disc. And let me just scroll down. Yeah, so this is normal. See, a big disc coming and compressing the right, mainly the right side, the central disc too. And this is normal. At the other level, this is normal. So this is the MRI of the lady, and the medics would know that she must be in a lot of pain because of such a big compression on the spinal cord. And there are different methods of treatment. Like you can go in for conservative treatment. You can put her on drugs, which she already had taken. You can give physiotherapy. She's been through that for a long time, and now there was numbness in the leg, and there was signs of neurological deficit. That means the power was down, and on the right side, some little bit on the left side too. So the option left was surgery. The patients are really scared of surgery because the first thing they ask whether would I be able to walk after surgery, and then say yeah, of course. And then the second question was how big is going to be the operation. Then when I tell them it's going to be an outpatient procedure, they are taken up by surprise. Now this procedure is actually endoscopic surgery, where I usually do not give a stitch, not even a stitch, and I admit the patient in the morning, and the patient is out by the evening. I take maybe half an hour to 1 hour for the surgery, and it's an intricate surgery. It's a delicate operation. It's not that you can do it without training. This is a model of spinal canal. The transparent pipe that you see is of the diameter of 1.5 centimeter, just like the spinal canal. And the thin threads, they replicate the spinal nerves, which are very delicate, very thin, just like the hair. And the blue thing, the blue cotton, that's pressing on the nerves, and this replicates the disc, actual disc in the spinal canal. Endoscopic spine surgery, we make a small hole in the pipe, in the canal, and we try to take out the disc in one piece, preferably, but maybe we might have to take a piecemeal. So this instrument is taking out the disc, and it's a very delicate surgery. And if you falter, you can damage the nerves, which are very, very delicate. Once damaged, they are beyond repair. So you can see how finely the disc is being removed, and now you can see that I'm trying to take out the nerve, which can be stuck to the disc. And if you're not careful, if you do this, it's disaster. Just like the model, this is the actual spinal canal, and I'm trying to make the hole. Actually, I made the hole, and I'm trying to make it a little bit bigger. So I'm nibbling on the ligamentum flava, and you can see the nerves just behind that. They are. We call it breathing of the nerves because they're pulsating with the blood flow. Each heartbeat, the nerves they pulsate, and let's see, it's a very delicate operation. As you can see, I'm slowly trying to make the hole bigger, nibbling on the ligamentum flava, removing all the extra pieces of tissue, and you can see the pulsation very clearly. That's the nerves behind, and the fluffy thing, what you see, the glistening thing, that's the epidural fat, which is surrounding the nerves. The red small delicate things are the arteries on the nerves. And oops, there's some bleeding is there. I'll have to coagulate it. So we have special instrumentation, which I can burn these small bleeders, and the bleeding stops, because if it keeps on bleeding, I can't operate. I can see anything. So here's the cautery, the RF probe, and see, I have burned the bleeder and stop it. But this is a very delicate operation, as I've been telling you before, and this instrument doesn't damage the nerve. The bleeding stopped, and now it's much clearer, as you can see. That's one strand of the ligament that I'm about to cut, and I have to be very, very careful, otherwise I might damage the nerve just beneath it or just behind it. So you can see that how carefully I'm trying to negotiate my instrument. And this instrument is somewhere near maybe zero point 0.2 mm in the width. It looks very big here, but it's actually 0.2 mm, zero point 0.3, maybe 0.4 mm. And I must share with you that while doing this, I have to stop my breath. I have to keep my hands very, very steady, and I have to control each and every movement in my body. Now you can see the disc, the cotton-like tissue just beneath the nerves. It's a big disc, and I'm trying to grab it. You see how delicately I negotiate it, and I take hold of the disc and I pull it, and I'm very careful that I don't pull any nerves. And you can see it's a fluffy tissue, just like the cotton which I pulled in the model, and I'm removing it. And I search for some left out pieces, and I'm very careful. I lift up the nerves and remove the left out pieces of the disc carefully.
ਮੇਰਾ ਨਾਮ ਮਨਦੀਪ ਕੌਰ ਹੈ। ਮੈਨੂੰ ਸਪਾਈਨ ਦੀ ਪ੍ਰੋਬਲਮ ਸੀਗੀ। ਅੱਜ ਮੇਰਾ ਆਪਰੇਟ ਹੋਇਆ 1 ਘੰਟੇ ਬਾਅਦ ਡਾਕਟਰ ਨੇ ਮੈਨੂੰ ਖੜੇ ਕਰਤਾ, ਚੱਲਣ ਯੋਗ ਕਰਤਾ। ਥੈਂਕ ਯੂ ਸੋ ਮਚ ਡਾਕਟਰ ਸਾਹਿਬ। ਪੇਨ ਬਹੁਤ ਜ਼ਿਆਦਾ ਸੀਗੀ ਮੈਨੂੰ। ਆਪਰੇਟ ਤੋਂ ਪਹਿਲਾਂ ਵੀ ਬਹੁਤ ਜ਼ਿਆਦਾ ਪੇਨ ਹੋ ਰਹੀ ਸੀ, ਬਟ ਆਪਰੇਟ ਹੋਣ ਤੋਂ ਬਾਅਦ ਪੇਨ ਮੇਰੀ ਬਿਲਕੁਲ ਠੀਕ ਹੈ। ਥੈਂਕ ਯੂ।